about to lose my mind. One step away from the red line.
Welcome to this week's episode of Unspoken Truths, Trauma in the Black Community. In the last episode, I mentioned that this episode would be dedicated to barriers to care. However, I made a last-minute decision to switch things up, and I invited a special guest to the conversation instead. Let's begin with a recap of episode 4, titled The Effects of Trauma on Mental and Physical Health. In that episode, I discussed mental and physical health conditions. I talked about the COVID-19 pandemic's disproportionate impact on the Black community. I shared personal stories about mental and physical health challenges. I talked about the importance of advocating for yourself or a loved one, and I emphasized the importance of preventive measures to effectively manage your health. If you missed episode 4, be sure to check it out. For episode 5, I am honored to be joined by today's guest, Jalisa McCullough. Before we dive in, let me share a little bit about Jalisa. From a personal perspective, Jalisa is the proud mother to her daughter, Janiyah, who is her pride and joy. As a high honor roll student, I can say that the apple didn't fall too far from the tree. Jalisa loves to travel, but she dedicates time to practicing self-care. And more importantly, she takes advantage of every opportunity to spend time with family and friends. In terms of her professional experience, Jalisa is a psychiatric mental health nurse practitioner. She graduated from the University of Rochester School of Nursing in May 2020. Prior to becoming a psychiatric mental health nurse practitioner, she worked as a psychiatric registered nurse for 8 years. She currently works as a nurse practitioner in private practice. Prior to this, she worked on the Monroe County Mobile Crisis Team for 4.5 years. I don't know where she found the time or the energy, but she also spent time as an adjunct faculty at the University of Rochester School of Nursing. Jalisa has a passion for working with clients and their families. When asked what she enjoys most about her role, she stated that the most fulfilling and rewarding aspect of her job is being able to provide relief and support to families in their time of need. And trust me, I can validate everything mentioned because as her aunt, I have witnessed all of her Black girl magic from the front line. Jalisa, thank you very much for joining me on this episode.
Thank you so much for having me today.
So, as you know, I recently completed my doctoral studies focused on the long-term impact of childhood trauma in the Black community. As a mental health trailblazer, you have had an up-close and personal view of the overall impact that mental illness has on our society. As of September 2nd, 2025, the World Health Organization reported that more than 1 billion people suffer from a mental health disorder. While this number is astounding, it doesn't provide a comprehensive view. It may include all races and ethnicities, but it only represents people who sought treatment. And I stress sought because research has found that a high number of these cases are unaccounted for, especially in the Black community. As we both know, untreated trauma can manifest in ways that affect our mental and physical health. When I started my research, I focused on adverse childhood experience, also known as ACEs, which are traumatic events that occurred during the first 18 years of life. As a Black culture, we have endured a great deal of trauma that dates back more than 400 years. So trauma is not new to the Black community. As a psychiatric mental health nurse practitioner, I thought it would be great to get your thoughts on a few questions that are specific to mental health issues in the Black community. So let's dive in if you're ready.
I'm ready for you.
All right. First question. From your experience, what would you consider to be some of the most common mental health challenges facing the Black community today?
I think the top three that I see are depression, anxiety, and PTSD. I think it just manifests differently in our culture. So, as a couple of examples, depression can show up very differently in Black people, especially Black women. Sometimes our depression shows up as irritability, or sometimes we get labeled as having an attitude or being aggressive, when simply we are also experiencing, a lack of joy and sadness, and is being misinterpreted as aggression. In terms of like anxiety, the added stress that we have to deal with, and just from living in a capitalist society that is founded on racism, the stress from that and just trying to survive day to day, a lot of us have undiagnosed anxiety disorders. And that goes along with PTSD, which is post traumatic stress disorder. I mean, Black people have the highest rates of exposure to trauma because we are constantly on a daily basis being exposed to microaggressions, discrimination, and just all around racial injustices, on top of dealing with generational trauma that is passed down through families or happening in our homes. And then the day to day things that happen just because, disasters in the world or just things that are happening in the news. So we are constantly bombarded with trauma and not understanding that our responses to that are really PTSD.
You highlighted a great deal, and everything that you just talked about in terms of the trauma I referenced in episode 3, where I talked about historical, intergenerational, and racial trauma. And it's real for those who have lived it, and some of us who continue to live it on a daily basis. It is real. The struggle is real. So thank you for that.
Thank you.
Next question. What are your thoughts about medication? More specifically, what role do you see medication playing in treatment? And how do you help your patients determine whether or not if medication is right for them?
So I think medication tends to come into play when we see a change in function, more specifically, a decline in someone's functioning. So typically, like in depression, when I start to think, oh, medications like antidepressants might be useful for this person, is when I see people saying, sometimes it's hard for me to get out of bed or brush my teeth, or some days I don't shower because I just don't feel like it. Um, or, I've been calling out of work lately because I've been sad, or I've been getting in trouble at work because I've been snapping at people. So typically, when you see someone not able to function at their baseline or show up as their best self, that's when medications are helpful, because sometimes it is really hard for us to come out of that on our own. So, and in other disorders where medications are very much highly encouraged, such as schizophrenia or bipolar, I think that the role of medication in those disorders is to help us be one with reality. Because when we start to experience certain symptoms like hearing voices or feeling on top of the world or getting into risky situations, we put ourselves in very dangerous situations. So I think that medications can help protect us and get us back to reality.
I like that. And, I appreciate the fact that you talk about people being different. So, what may work for me may not work for you. And also the severity of what may be going on. So, while you may be able to treat one situation without medication, another situation may very well require medication. So, thank you for that. Now, what are some non-medication strategies you recommend for managing things such as anxiety or depression?
So definitely therapy, and a lot of mental health disorders, such as like mild depression or generalized anxiety disorder, the first line of treatment is actually therapy. So a lot of times when you go to your doctor or you go to see a therapist to seek help, medications will not be recommended. It will just be, whether it's weekly or biweekly or monthly therapy sessions, which I call a workout for your brain. It really helps you to process your feelings and build coping skills to manage your anxiety or depression symptoms. Now, in some more severe cases, there are higher levels of therapy called like outpatient intensive programs that you are going to like group therapy and individual therapy on a daily basis because you may need some more intense intervention at that point. So, that's one option, but there's also like self-care strategies. Exercise is huge. That is great prevention for mental health issues. So, exercising at minimum 3 days a week can really help balance out your hormones, especially your brain hormones. Um, Engaging in regular self-care activities that are healthy, such as like taking walks or spending time with family or friends that, help you feel great about yourself, engaging in hobbies, whether that's the arts or yoga or meditation, just doing things that help you feel good. It's literally just as simple as that.
Well,
So,
I'm gonna tell you, I'm a huge proponent of exercising. I get my workout on every day. Yep, every day. And it does truly make a difference. So I value that insight. Thank you.
you're welcome.
All right. Next question. Seeking formal treatment is frowned upon in the Black community. What barriers do you see that prevent people from seeking care, and how can we work to eliminate those barriers?
So I think that there are several barriers that come into play. So firstly, there's the stigma. There's still a stigma around mental illness in the Black community. I don't know where it started, but it really holds us back because it sort of puts a label on a mental health issue as if it's something bad. But I think that's quite unfair because if someone had an ear infection or they hurt their leg, I think that, they would seek care for that. So if someone is having anxiety or, maybe having altered thinking, why would it be wrong to seek care for that? I also think that there's a significant mistrust in the healthcare industry because of the way historically Black people have been treated and abused in the healthcare system. For example, the Tuskegee syphilis situation where we were experimented on and infected. I think that the lack of providers that look like us is also a barrier. There's when we have this distrust, we don't want to go into a situation with people that we don't trust.
Right.
We want to see people that look like us that may have more of our interest at heart, our well-being.
Yes,
hmm I
I
think also,
appreciate that. Yeah, sorry.
yeah. And I also think the cost, healthcare is very tricky right now. Health insurance is not covering what it used to cover, and it's not as widely as available. So I think that's also a barrier because everyone cannot afford to pay for therapy out of pocket or a $1,000 visit to see a psychiatrist or psych NP.
Yeah. What I would suggest, and I'm going to talk about barriers to care next week, but what I would suggest for those who are listening and may not be able to catch that episode, what I would encourage you to do is if you're employed and your organization offers employee assistance program, take advantage of that. Utilize whatever resources you have available to you to get the support that you need to protect your mental well-being, your mental and physical well-being. Okay.
Absolutely.
Thank you, Jalisa. Next question. Research has shown that there aren't enough culturally sensitive therapists, which can be problematic. And you talked about this a little bit in the prior question relative to barriers to care. How important is representation and cultural competence in mental health care?
It's very important to the point that it's make or break. I mean, there are people who will not go to a visit if their provider does not look like them because of the lack of trust. Or they will start with a provider that doesn't look like them because one isn't available. And then they'll see someone who just is not culturally competent, and that will break the therapeutic relationship, and the patient may not return. This is happening every day in healthcare. I have gotten numerous referrals for clients of color that have waited to get accepted to services with a Black provider because they've had such terrible experiences with non-Black providers. So it is so important because it can really be the make or break decision between someone seeking care and not seeking care or accessing care.
Yeah. And I will tell you, I had a personal experience when my mom passed away where I was encouraged to go and see a therapist. And I reluctantly went. I didn't want to go, but I did end up going. And it wasn't a good experience. It was a white, older female. And all she did was talk about her own personal experience with death and dying. Her husband had passed away. And so I knew in the first, I would say 15 minutes that I wasn't going to go back to see her. But I said, let me give her the benefit of the doubt. But after the second appointment, I never went back. Never went back. And I provided feedback to the employee assistance program provider.
That
So,
experience is
yeah.
very common experience
Yep.
you had. Absolutely.
Yep. Well, thank you for that. What advice would you give someone who feels hesitant or fearful about starting therapy or psychiatric care?
I would say be brave and take the leap. I would say if you had allergies, you would go see an allergist. If you broke a leg, you would go see an orthopedics. If you had some sort of infection, you would go see your primary care doctor to get antibiotics. So if you are dealing with a mental health ailment, you should seek help from a mental health provider. When one of our organs is not functioning correctly, like our heart, our kidneys, our bladder, we go see the specialist for those. Well, don't forget that your brain is also an organ and it can malfunction just like the rest of your organs. So when it is malfunctioning and you're not able to refix that on your own, seeking help to a professional that is, meant to help with that is really the way to go. So it's okay to not be okay, just like it's okay to have allergies. It's okay to deal with some anxiety and get help with that.
I like the comparison because you hit the nail right on the head. When we think about physical, when we're in pain, we go seek help more often than not. Now, in the Black community, what we tend to do is we tend to wait a few days to see if it's going to go away on its own. And then if it doesn't go away, then we will go seek help. But your point about when our brain is not functioning properly, we let that ride out instead of going to get the help that we need. And so the longer that you allow that to continue, the worse the condition may get. So the earlier you can get that support, the better off you are. I always talk about health being wealth. So if your mental is not where it needs to be, your physical is not going to be there either because they go hand in hand. Well, Jalisa, that was my last question. So what I would say to you is, everything that you talked about, this was impactful. You definitely dropped some jewels today, and I'm forever grateful to you for carving out time to educate us on mental health, because I know how hectic your schedule is. So I truly, truly appreciate you coming on and sharing with our listeners the importance of mental health. Your subject matter expertise on mental health is inspiring. It's truly inspiring. And I encourage you to continue on your path because your contributions will definitely make a significant impact, especially in our community, the Black community. As we prepare to close out this episode, what final message would you offer to our listeners about mental health?
I know this may sound very generic, but it is okay to not be okay. If you need help, get the help that is available to you, because the longer you take and the longer you wait it out, you are going to regret that you waited so long. You do not have to suffer. Help is available.
Thank you for that. Because a lot of people suffer in silence. We do. We suffer
Absolutely.
in silence, and we don't have to. We don't have to. Thank you. If people are interested in connecting with you, how would they go about doing that?
So right now I'm doing private practice. So I have a website that I can share with you. And right now there is not any availability because like many Black providers, we are booked and busy. But the availability opens up over time because people get better and then they kind of graduate out of services. So you can share the link with others and they can just check periodically as slots open up. And you can also, on the website, you can see if I accept your insurance so that you can make sure that the services are covered.
Okay, sounds like a plan. So, again, thank you for your time, and I wish you continued success as you continue to explore ways to break barriers in the mental health space. So, this wraps up this week's episode. In closing, I want to thank you for joining me for another episode of Unspoken Truths Trauma in the Black Community. Remember, your voice matters, your healing matters, and together we will rise. If this week's episode resonated with you, or if you know someone who can benefit from the information shared, please like, share, and subscribe so we can continue to have these discussions. It's important to understand that no one should ever feel as though they must walk this path alone. With the proper support systems in place, we will rise above the adversities caused by trauma. Join me next time as we continue speaking the unspoken and healing the unseen. Until then, stay strong, stay rooted as we continue to break generational curses one person at a time.
Thank you.
Thanks for watching. Don't forget to like, comment, subscribe, and share.